BPH is benign prostatic hyperplasia. In layman's terms, what that means is prostate enlargement. This is very common in men as they age. It's typical for men's prostates to grow as they get older. For the initial management of BPH, of course, there are a number of treatment options. There are medicines called alpha blockers. The most common two are tamsulosin and alfuzosin, otherwise known as Flomax and uroxetrol. If symptoms are not responding initially to the alpha blocker treatment, there are other medicines that can be used which can help shrink the size of the prostate. Those are called 5-alpha reductase inhibitors. About 80% of men can avoid surgery with a combination of the medications. In the event that medical management is not adequate for treatment of BPH, this is where surgical intervention would be indicated. The gold standard is called the TURP, or the transurethral resection of the prostate. There are also laser treatments that can be done where the excess prostate tissue is essentially vaporized to open up the channel. There's a newer procedure for enlarged prostate for patients with less severe symptoms, and that's called a urolift. It's marketed as having no incisions, and essentially it staples up the sides of the prostate to open up the channel. And this is generally recommended for patients who want to get off of medications and have more mild symptoms. However, there are some lifestyle measures that men can do to help minimize the effects of symptoms that they experience from BPH. This includes avoiding bladder irritants. The most common would be caffeine, alcohol. Spicy or acidic foods can sometimes act as a bladder irritant, as well as artificial sweeteners. So those things that can be avoided can be beneficial.